Hi everyone, it's Dr. Dave and I am coming back to you today with a very interesting study that was recently published in the New England Journal of Medicine on the safety of the COVID-19 vaccine. This study was from Israel, and it helps address a couple of concerns. As most of you know, I am a proponent of the vaccine, very, very important in order to get COVID-19 original strain as well as the Delta and some of these other variants under control. But there has been concern about potential side effects from the vaccine, which I completely understand. So this was a very interesting study. And one thing I just want to focus on, I'm not going to go into the entire study or the details of everything the study showed, but one thing I want to focus on, because it's been coming up in my office, in my practice as a cardiologist, is this idea of myocarditis. Myocarditis, it's actually myocarditis / pericarditis. Myocarditis is inflammation of the heart muscle. Pericarditis is inflammation of the sac that surrounds the heart. So the question is, does COVID-19 vaccine increase the risk of myocarditis, especially in children? And the answer is yes, it does increase the risk of myocarditis. However, when you compare that risk to actually getting infected by the COVID-19 virus, the risk with the vaccine appears to be much lower. So the vaccine will increase your risk of getting myocarditis by 3 times. COVID-19 infection will increase your risk of myocarditis by 18 times. So that's 3 times with the vaccine and 18 times with the actual infection. So clearly, the infection increases your risk much, much more than the vaccine. Now, I just want to give everybody a couple of words of caution here with this study. The one thing I do not like about this study is it's not clear to me how they substratified, meaning they didn't make it clear kids versus teenagers versus adults versus elderly people. So I still think that there's a lot of questions that need to be answered, and we will answer them because we are learning as time goes on. We are all learning about COVID-19, both the healthcare providers as well as the public. But at the end of the day, we do need to make sure that we are listening to the healthcare providers. You know, there's a lot of misinformation on the internet. There's a lot of people trying to sell you stuff based on COVID-19. And there's a lot of people that have their own personal and political agendas. But at the end of the day, I think we need to let science lead the way. Okay, everyone, I hope that helps. I do want to bring up a company that I've partnered with that I feel very strongly about. It's called Save a Life. Save a Life is a company that offers courses online, some of them free, on CPR, basic and advanced life support. This is incredibly important because the #1 killer in the United States, as everybody knows, is heart disease. So CPR is very important if somebody has a cardiac arrest. The faster we can intervene, we can start CPR on that person, the higher the chance of saving their life. So the company's name is Save a Life. I'll put the link below. I'll put the link to the free course below, and please check it out. Okay, everybody, until next time, this is Dr. Dave.